Good morning. Today we'll be seeing about anal canal. So what is this anal canal? That is the terminal part of the large intestine. So this we'll be seeing under following headings: where it is located, then what are the features, like what is the extent of it, and next thing we'll be seeing the interior of the anal canal. Then at last we have sphincters related with this anal canal, and at last followed by arterial supply, venous drainage, lymphatic, and nerve supply. So where it is located? So basically anal triangle. In this anal triangle we have this anal canal and ischio anal fossa. If you see the perineum, so if this is the in lithotomy position, ischial tuberosities, and behind there is coccyx, and you are drawing an imaginary line passing through ischial tuberosity. So in the middle there is perineal body. This will be sacrotuberous ligaments. Anterior part, posterior part. So now in this anal triangle, it's having in the center anal canal. Anteriorly it has perineal body, posteriorly coccyx, and attaching this coccyx with the anal canal there is a raphe called anococcygeal raphe, and on either side it's having ischiorectal fossa. So regarding the location, it's present in the perineum. In that specifically we can say it's present in the anal triangle. And how is the extent of it and how is the course of it? If you see one more diagram in the lateral view, how it looks is it goes backwards and downwards from the anorectal region. This is the posterior part. Anteriorly, if it is females, there will be vagina, and anterior to that there will be urinary bladder. Posterior, anterior. So this is the anal canal. This will be the uterus which continues down with the vagina, and this is the urinary bladder. This is a female pelvis. If you see in a female pelvis anteriorly, this is posteriorly. So if you see the extent of it, it's starting from anorectal junction, and from there the lower end is near the anal orifice. So what is the distance between these two? How much is it? It will be approximately around 3.8 centimeters. So the length of anal canal is 3.8 centimeters. It's extending from the anorectal junction to the anal orifice. So what is the muscle near this anorectal junction? Surrounding that there is a muscle which is extending from the pubic bone, that is puborectalis muscle. So if this muscle is damaged, there will be anal incontinence. So in rest, anal orifice, anal canal, the both lateral walls will be approximated towards each other, and the anal canal looks something like a slit. During defecation, this slit will be expanding up. Then what are the other things related with this anal canal? Anal canal is supported by two muscles, two sphincters. In that, one is voluntary and one more thing is involuntary. So one is internal anal sphincter and other one is external anal sphincter. So this is regarding this location, and next thing is how it is related with other structures. If you see in this diagram how it is related with anteriorly, what is related with this anal canal, perineal body, it is common for both males and females, and if it is in males, anterior to that there will be bulb of penis followed by membranous urethra, bulb of penis and membranous urethra. This is membranous urethra. That are the anterior relations for this anal canal in males. In females, anteriorly there is vagina. Then posterior relations for both, it's common for both. Posterior to this, these are anterior relations. Posterior, what you find in this diagram, posteriorly there is coccyx, and attaching this coccyx with the anal canal there is a raphe called anococcygeal raphe. So that is posterior relation. Then what is that space on either side of this anal canal? So on either side of anal canal, that is a space called ischio anal fossa. So what is present in this ischio anal fossa? Ischio anal fossa will be having a pad of fat, so that will be helping in dilatation of the anal canal during defecation. Then next comes is the interior of this anal canal. So how does it look interiorly and how we are dividing that? So anal canal is one thing which is derived from two parts. One is ectoderm and one is from endoderm. And how do you demarcate that? There is a line demarcating this ectodermal derivative from the endodermal derivative. That is called pectinate line or a dentate line. So if you see a section of anal canal, we'll draw the muscles later. This is only regarding the interior of this anal canal. So you are dividing that into upper half and lower half by a line called pectinate line. So what is this line? Pectinate line, other name is dentate line. So this is dividing that into upper part and the lower part. So this pectinate line is it's like a watershed line, because the upper part is derived from, regarding the derivatives, this is derived from endoderm, whereas the lower part is derived from ectoderm, proctodium. It's developed from proctodium in specific. And coming to the lining of that, upper part is lined by columnar, simple columnar epithelium, whereas the lower part is lined by stratified squamous non-keratinized epithelium. So that is one more difference between the upper part and lower part. So upper part is derived from endoderm, so it's having simple columnar epithelium. Lower part is derived from proctodium in specific, and it's lined by stratified squamous non-keratinized epithelium. And if you coming to the upper part, its length is around 10 mm. Same way, the remaining lower part will be approximately 18 mm. That is again further divided into two parts. First we'll be seeing the upper part. So in the GIT we have from inside to outside mucosa, submucosa, muscularis externa and serosa. So innermost layer of this anal canal is having mucosa. So the mucosa in this is thrown into longitudinal folds. These longitudinal folds are called anal columns. So these longitudinal folds are nothing but folds of the mucosa. Underlying that folds of the mucosa, there are tributaries of superior rectal vein and branches of superior rectal arteries. So this is anal columns. So if you see the lower end of the anal columns, again the mucosa is thrown into folds. So these folds these folds are called anal valves. So these folds which are at the lower part are called anal valves. So these will be all be present at the lower end of the anal columns. So this is again a fold of the mucosa. This is again a fold of mucosa. So these are from above downwards, these are from side to side. So these are anal valves, these are anal columns, and the gap between these anal columns, these are called sinuses, anal sinuses. So these are named like anal columns of Morgagni, anal valves of Morgagni. So what are the parts in the interior part of the upper half of the anal canal is? Above is derived from endoderm and the epithelium lining is simple columnar epithelium. And if you come to the interior part, the mucosa is thrown into folds, longitudinal folds. These are called anal columns, and in the lower part we have horizontal folds which are called anal valves of Morgagni. These are anal columns of Morgagni, and in between that the space is called anal sinuses. Into this anal sinuses there are openings of anal glands. So if there is any sometimes there is a problem in this anal sinuses that is leads to fissure. Anal fissures are related with this anal sinuses. If you see the applied aspect, there you get that anal fissures which are concerned with this anal sinuses. So that is regarding the upper part of the anal canal. Then coming to the part below the pectinate line, that is again divided into two by a line called white line of Hilton. So this which I am demarcating with a different color, this is white line of Hilton. Above the white line of Hilton, that region between the pectinate line and the white line is called pecten, and this region between this pecten line and this is different again. So above this white line, this region is approximately, this will be again 10 mm, and the area below this white line, it will be approximately around 8 mm. So this white line, the region between the pectinate line and white line, that is pecten, and this is derived from proctorium, and here the mucosa appears bluish. Why so? Because underlying the mucosa there are abundant venous plexuses. So because of that abundant venous plexuses, this appears to be bluish in color, and the lining epithelium here is stratified squamous non-keratinized epithelium, that is in the pecten, and it doesn't have any anal columns, anal valves, or anal sinuses. It's something like smooth. Then the region below this white line, this is lined by skin, skin with all the sweat glands and sebaceous glands. So this white line, importance is white line is where there is a junction between mucocutaneous junction. Which is a mucus part? The pecten is having mucus lining, whereas this region below that, that is lined by the skin, and in that we have sweat glands and sebaceous glands and hair follicles are there. So that is the internal part of the anal canal. So you are dividing that into upper part and lower part by a line called pectinate line or dentate line. And pectinate line and dentate line, what is the other demarcation of this pectinate line and dentate line is the region above that the derivative is derived from endoderm, and region below that is derived from ectoderm. So based on that you have different arterial supply for the upper part, different arterial supply for the lower part. So this pectinate line is also called a watershed line. Then below the pectinate line, between the pectinate line and the white line of Hilton, that region is called the pecten, and below that this is lined by skin. Pecten is lined by stratified squamous non-keratinized epithelium. So coming back to sphincters. So in the anal canal, related with the anal canal, there are two sphincters. One is internal anal sphincter. One more thing is external anal sphincter. So internal anal sphincter is involuntary, whereas external anal sphincter is voluntary. So internal anal sphincter is having autonomic nerve supply. External anal sphincter is supplied by inferior rectal nerve and perineal branch from the sacral nerve is fourth, that is from the fourth sacral nerve. So for this, first we'll be seeing how this anal canal will be there. So in the GIT we are having inner circular and outer longitudinal muscle. So the inner circular muscle of the rectum is containing down into the anal canal as the internal anal sphincter. So this will be extending from the anorectal junction till the white line. So it's extending only till the white line. So it means it will be only for 15 mm. So upper part of the anal canal is 15 mm. You make a correction in that readings. And lower part is 15 mm, that is pectin. Then below the white line it's around 8 mm. So make a correction in the previous thing regarding the measurements of the anal canal. So upper region from the anorectal junction till the pectinate line is around 15 mm, and from the pectinate line till the white line it's 15 mm. This region is pecten. Then below that pecten till the anal orifice, that is around 8 mm. So this is internal anal sphincter, which is nothing but modified inner circular muscle layer of the rectum. What lies deeper to this internal anal sphincter is it's having venous plexuses underlying the mucosa. So innermost is mucosa, then in the submucosal layer there are this venous plexus. So this orange line is mucosa, underlying that mucosa in the submucosa there are venous plexus, then followed by internal anal sphincter. So internal anal sphincter, what is the function of it? It's a involuntary. This is involuntary. It's under the control of autonomic nervous system. It's having both sympathetic and parasympathetic nerve supply. Then outside that, the longitudinal muscle of the rectum, it's coming down, so you are calling it as the conjoint longitudinal muscle, which extends till the white line here. From that, this conjoint longitudinal muscle will give some fibrous septations. If you go to the medial part, if you go to the lateral part. The medial part is the intersphincteric groove. So related with that, we have a septa, medialmost septa from this longitudinal conjoint longitudinal muscle coat. So one of this medialmost fibrous septations is present in this intersphincteric groove, which is near the white line of Hilton. Then outside this white line, outside this conjoint muscle, there are three muscles or three parts of the external anal sphincter. One is the deeper part, which is related with the upper part of the internal anal sphincter. One thing is superficial, which is related with the lower part of the internal anal sphincter, and then we have a subcutaneous part through which we have this septations of the conjoint muscle going. So what are the three parts of this external anal sphincter? This is deep, this is superficial, this is, it lies below the skin, so subcutaneous. So these are the three parts of the external anal sphincter. What are they? Deep, superficial and subcutaneous. Deep part is related with this upper part of the internal anal sphincter. Superficial is related with the lower part of the internal anal sphincter, and below the white line there is subcutaneous part of the external anal sphincter. So this part, this is where you have the demarcation. White line of Hilton is in near the lower end of the internal anal sphincter and subcutaneous part of the external anal sphincter. So regarding the attachments of this external anal sphincter, before that we have a pubo-anorectal sling. So what is this anorectal sling? So this is having three constituent parts. Uppermost fibers of the deep part of the external anal sphincter, and few fibers from the internal anal sphincter, and few from the puborectalis muscle. They form this anorectal sling, which is concerned with the continence of the anal canal, anal continence. Then coming to this attachments of this external anal sphincter. So if you see one more diagram here, so if this is the anal canal, rough diagram of that. In the upper part, it's related with the few fibers of puborectalis. There is a circular muscle. So this is deep part of the external anal sphincter. It's related with few fibers of puborectalis. Then next muscle, this is coccyx, anteriorly perineal body. So having attachment to these two, the fibers are arising from this coccyx and anococcygeal raphe, and they are surrounding the anal canal, and it's attaching to the perineal body. So this is the superficial part of the external anal sphincter. So how is the shape of the superficial part? It's elliptical. Then comes the subcutaneous part, which is again having no bony attachment. So what is the shape of this? This is also circular. So this is subcutaneous part of the external anal sphincter. So external anal sphincter is voluntary. So what is the nerve supply? It's having nerve supply from inferior rectal nerve and perineal branches from the S4. Perineal branches from the fourth sacral nerve. Then a revision of this. So this lateralmost fibrous septa is called perianal fascia. So the space between the perianal fascia and the skin is the perianal space. So here we can have three spaces in relation with the anal canal. So what are they? One is this. On either side of the anal canal there is fat filled space, that is ischio-anal fossa. So this part is ischio-anal fossa. Then one more space is between the perianal fascia and the skin. So that is perianal space. This is having again fat. So what is the function of this ischio-anal fossa? That is helping in expansion, or you can say dilatation, of the anal canal during the course of defecation. Then what is the other space here? This is the mucosa. This is the internal anal sphincter. In between this mucosa and internal anal sphincter, that is the space. Third one, that is submucosal space. So what lies in that submucosal space? And there there are abundant venous plexus forming there. Then coming to the arterial supply, venous drainage and lymphatics and nerve supply. And what is the peculiarity of that white line? White line, white line is demarcating between the lower end of the internal anal sphincter and subcutaneous part of the external anal sphincter. So coming to the arterial supply, venous drainage, and applied aspect. For that, you will be seeing the same mold, that is anal canal, having, you're dividing that into upper part and lower part by a line called pectinate line or dentate line. So above the pectinate line is derived from endoderm, below it's derived from ectoderm, that is proctodium. Then arterial supply of the upper part is by superior rectal artery, lower one is supplied by, below the pectinate line is supplied by inferior rectal artery. Same way venous is by superior rectal vein and inferior rectal vein. Superior rectal vein is a tributary of the portal system. Inferior rectal vein is tributary of the caval system. So at this junction there is an anastomosis between the portal veins and the caval veins. So whenever there is portal hypertension, there are dilatations of this portocaval anastomosis. That dilatations we are calling it as hemorrhoids. So these hemorrhoids may occur above the dentate line or pectinate line and below the pectinate line. So above the pectinate line, if they are occurring, they are called internal hemorrhoids, and if they are occurring below the pectinate line, they are called external hemorrhoids. So there is one more important thing regarding this internal hemorrhoids and external hemorrhoids is internal hemorrhoids are painless and external hemorrhoids are painful. Why? That there comes the point of the nervous supply for that. This area above the pectinate line is supplied by autonomic nerves, whereas the lower part is supplied by somatic nerves. So that is the reason why the internal hemorrhoids, they will be painless, whereas the external hemorrhoids are painful because they are having a somatic nerve supply below the pectinate line. Then coming to the lymphatic drainage, above the pectinate line is drained into internal iliac nodes, and below the pectinate line is drained into superficial inguinal nodes. So what is the basic thing near this hemorrhoids is, hemorrhoids, as you have seen in the anal canal, innermost is the mucosa, then followed by the veins, venous plexus, then followed by the internal anal sphincter. So whenever there is portal hypertension, these veins will be dilating. So hemorrhoids are nothing but the dilated veins along with the mucosa lining that anal canal. So these dilatations are most commonly seen in three positions. One is they are related with the, to describe them, they are correlated with the clock. So 3 o'clock position, 7 o'clock position and 11 o'clock position. So these are the three common positions where there are hemorrhoids seen. More commonly seen are this 3 o'clock position, 11 o'clock position and 7 o'clock. So what are the hemorrhoids? Hemorrhoids are nothing but the mucosa lining the dilated veins. They might be superior rectal vein, or the inferior rectal vein. So that is caused because of the portal hypertension. That is one applied aspect of that. Then the other applied aspect is, as you have seen before, in the upper above the pectinate line there are some columns. In between the columns there are sinuses. So in this sinuses there might be impactation of fecus, and if it is infected there may have fissures in them. So fissures are present in the are caused in the anal sinuses. Then apart from that, if you see, next applied aspect is if there is an infection in this ischioanal fossa, this abscess may spread into the anal canal, and this will be spreading outside to the skin. And this infection, if it is not controlled, this entire thing will be forming a tract. So this tract is having two openings. One is in the anal canal, one is outside the skin. So these are called the fistula in ano. So these are the three applied aspects. One is hemorrhoids, that they are caused because of the portal, most commonly because of the portal hypertension. Next thing is fissures, which are common in anal sinuses. And one more thing, if some abscesses are not treated, there are chances of formation of fistula in ano. So pectinate line is called the watershed line. Why? Because above we have a difference, below we have a difference. Above the pectinate line, arterial supply is by superior rectal artery, and venous drainage is by superior rectal vein, which is a tributary of the portal vein, and the nerve supply is by the autonomic nervous system. That's why it is painless. Internal hemorrhoids are painless. Below the pectinate line, this is derived from ectoderm, that is proctorium. It's supplied by inferior rectal artery and drained by inferior rectal vein, which is a tributary of the cable system. Then these are supplied by somatic nerves. So these are painful external hemorrhoids. Thank you.